Hello, Healthy Care viewers. Today's video takes a closer look at some gross habits kids often display and whether these behaviors are harmful to their health. 1. Picking their noses. Boogers in kids, it's a common combo. If you scan a room full of children, chances are you'll catch one digging for gold. Kids often wipe the results on nearby surfaces or, even worse, consume them. This habit can lead to nosebleeds and even introduce bacteria into their nasal passages. To help, gently remind your child to use tissues and practice good hygiene. Make it fun by letting them pick out their favorite tissues or decorate a tissue box. 2. Licking dirty surfaces. Ever noticed how kids gravitate to the dirtiest spots, like public doorknobs or shopping cart handles, and then lick them? This is risky because bacteria and viruses can survive on these surfaces for hours. However, it's important not to go overboard with hand sanitizer. Encourage hand washing and teach them about safe surfaces without shaming their curiosity. 3. Hands down their pants. Kids often scratch their bottoms, especially if they haven't mastered bathroom hygiene. This can lead to pinworms or other issues. Teach them to wipe properly, use soap, and wash their hands after bathroom trips. If the scratching persists, it may be time for a quick check to rule out any infections. Make sure they feel comfortable asking for help if needed. 4. Using sleeves as tissues. When faced with a runny nose, kids often prefer wiping it on their sleeve rather than reaching for a tissue. While it's not the cleanest option, wiping on a sleeve actually keeps germs from spreading as much as wiping with hands. Teach them to use tissues, and remind them why it's important, but don't be too hard on them if a little bit ends up on their shirt. 5. Peeing in the pool. Many kids find it hard to leave the pool for a bathroom break. But peeing in the pool creates a chlorine-urine mix that can irritate eyes and even damage pool equipment. Explain the importance of taking bathroom breaks and why it's best to head to the restroom. Encourage them with gentle reminders during pool time. 6. Chewing on random objects. Hair, pencils, shirt collars, kids chew on anything within reach. It's usually a harmless habit but could introduce germs or even lead to dental issues. Encourage safer chewing options, like a specific chew toy or a healthy snack. This phase usually passes, so stay patient and guide them toward healthier alternatives when you can. 7. Picking at scabs. Scraped knees and elbows are a part of childhood, but picking at scabs can delay healing and increase the risk of infection. Explain to your child that scabs are the body's way of healing itself. You might try covering scabs with a fun bandage or finding a different way to keep their hands occupied. 8. Passing gas. Kids find farting hilarious, and many foods can increase gas, especially beans, dairy, and fried foods. If excessive, you can help them understand which foods may cause discomfort and gently encourage moderation. Remember to keep it lighthearted. Kids often find humor in bodily functions, and this phase will likely pass. Final thoughts. Kids are naturally curious and may engage in behaviors that seem gross. Many of these habits are common in childhood and are unlikely to cause significant harm. The key is guiding them toward healthier habits and teaching them the importance of hygiene in a way that feels natural and supportive. Thanks for watching. Be sure to like, subscribe, and hit the notification bell for more healthy care tips on keeping your kids safe and healthy.